Ever found yourself lying awake at 2 a.m., staring at the ceiling, counting sheep, but still not drifting off? Maybe it's the stress of an upcoming exam, or the city streets that just won't sleep. If this sounds familiar, you're not alone. Nearly a third of people experience acute insomnia each year, and around 10% faced a more persistent battle with it. Insomnia has many faces, and we'll be exploring a few of them. So grab a pillow and get comfy, because you're going to learn why getting a good night's sleep isn't always as simple as closing your eyes. There are two major branches of insomnia, acute and chronic. The key differences? It's all about the duration, causes, and how they're treated. Acute insomnia is short-term, typically lasting from a few days to a month. Chronic insomnia, though, goes beyond those occasional sleepless nights. It's when you find yourself lying awake, struggling to fall asleep, stay asleep, or waking up too early, at least 3 times a week for over a month. Although acute and chronic insomnia can look pretty similar, their causes are often quite different. Acute insomnia can be triggered by things like unfamiliar environments, stress, illness, or changes in medication. The good news is, it usually resolves on its own once the stressor disappears, or when you address the root cause. Whether it's adjusting your environment, getting into therapy, or tweaking your routine, acute insomnia can be managed fairly easily. Now, chronic insomnia, well, that's a bit more complex. It doesn't just go away when the stress passes. Instead, it sticks around due to long-term issues like chronic pain, arthritis, asthma, or even psychological factors like anxiety and depression. But don't worry, there's hope. One of the best treatments is cognitive behavioral therapy for insomnia. It helps people break unhelpful sleep patterns and rethink how they approach sleep. And, of course, let's not forget about sleep hygiene. Keeping a consistent sleep schedule, cutting back on caffeine, and yes, putting away your phone before bed. Relaxation techniques like deep breathing and meditation can help you calm your mind, and regular exercise works wonders for improving overall sleep quality. Initial or sleep onset insomnia is caused by the inability to fall asleep at the beginning of the night. Common triggers of initial insomnia include drinking too much caffeine or taking a nap too late in the day, alcohol consumption, stimulant medications, and stress. Overstimulation occurs when your brain goes into hyperdrive, which often makes it quite difficult to fall asleep. As an example, trouble falling asleep can lead to increased caffeine consumption the next day to fight against fatigue, which in turn leads to sleep troubles later in the day. This is why it's important to address initial insomnia right away in order to find the root of the cause before it gets to the point of chronic insomnia. Now, on to maintenance insomnia. This one is characterized by difficulty staying asleep throughout the night. So, a person experiencing this would wake up multiple times throughout the night, unable to fall asleep for at least 20 to 30 minutes. Alternatively, it could also present through consistently waking up earlier than planned and being unable to go back to sleep. Why does this happen? The one key cause that sets this apart from the others is sleep apnea, which is when your breathing stops during the night. However, it does have a treatment. This can be treated by a continuous positive airway pressure machine, better known as CPAP. The user wears a machine that pushes air into their mouth, nose, or both. If you're a parent or a caregiver, you might have heard of behavioral insomnia of childhood, BIC, because it affects about 25% of kids. So what is BIC all about? It's basically when kids have a tough time falling asleep or staying asleep without certain bedtime routines. Sometimes kids get used to certain routines, like being rocked or nursed to sleep, and when those routines change, bedtime can turn into a real struggle. Why is getting enough sleep so crucial? When kids don't get enough rest, they might become hyperactive, have trouble concentrating, or even struggle with memory, which can affect their school performance. But don't worry, BIC can definitely be managed with some helpful strategies. One method is to let them figure out how to fall back asleep on their own by not rushing in right away if they wake up. This helps them become more independent sleepers. Another approach is to check in on them less often when they wake up, so they get used to waiting a little bit longer for comfort. And finally, you can try slowly moving their bedtime earlier as they get better at falling asleep on their own. Insomnia goes beyond just the occasional bad night's sleep and can manifest in various forms. Whether it's acute insomnia lasting a few days or chronic insomnia that persists for months, identifying the root cause is key to finding relief and improving your sleep. If you or someone you know is struggling with sleep, feel free to share this video. Remember, we aren't doctors, so be sure to consult a healthcare professional for more guidance. With the right approach and a bit of support, you can restore better sleep and enhance your overall well-being. Thanks for watching, and don't forget to check out the resources below for more tips on getting the rest you deserve.